Well, good evening, everybody, and welcome, and thanks for joining this 1 hour session on a fast start to a see and treat service, hysteroscopy service with the MyoSure. My name is Alan Blair. I am the Clinical Applications Specialist Manager for the UK, and I'm joined this evening with two of my colleagues. You'll see them on the screens, hopefully. One is Sarah Smith, and Sarah is the UK Marketing Manager, and the other is Stacey Tatum, who is one of 5 clinical application specialists within the UK. So just going to run through the agenda once my slides move. So the agenda for this evening is we're going to do a review of the current UK guidelines, looking at the NICE guidelines and the latest COVID guidelines, then review the benefits of a see and treat service. And principally, this is what we're really trying to focus on, is trying to get those patients from the theatre setting into the outpatient setting so they have a very short stay for the procedure and off they go back home. We'll then review the MyoSure basics for those who are not too familiar with the MyoSure itself. Then we'll review the latest hysteroscope to be added to our range, which is the Omni 3-in-1 hysteroscope. Then we'll review the MyoSure exploring your options. Different handpieces are available and different setups within the outpatient setting is available as well, so we'll go through those in detail. And then we'll look at some of the documentation we have already available for a fast start setup. So rather than reinventing the wheel, you can take some of the documentation we have from various hospitals across the country and help use that as a template for your own service. And then at the end, we'll have a live Q&A session. So for those who are viewing this live session today, we will be able to give you a training certificate. So if, for instance, you are viewing this as a team, so maybe 2 or 3 of you are looking on one device, say a laptop, we will only have one email address and one name. So if your colleagues are joining you, please email us on the email address you'll see in the next slide with those colleagues' names and also the hospital you're joining from, and we'll get them their own individual training certificate as well, so just for this live session. We will be receiving questions throughout the session, and we'll be trying to answer them at the end of the session. If you are using a phone or an iPad, what you'll tend to do is tap on your screen and you'll see 3 dots appear. Click on those 3 dots, and then you should see this phone and iPad displayed here. Click on the Q&A and you can type in some questions to us. We also, if you're using a laptop, it's slightly different. Just click on your question mark symbol and then go to your Q&A and type in your question, and you'll start to see them coming through. So as I say, we'll try and answer those questions at the end. Finally, this is the email address if you'd like to contact us. The team are all available, we're all working, we're able to come into your hospital if it's safe to do so to provide support, but also if you'd like some support over the phone or via WebEx, please just contact us on the UK ginsurgical@hologic.com email address here. And I'll also show this email address at the end as well if you've not had time to get a pen and paper ready. So without further ado, what we'll do is I'm going to hand over to Sarah, and she's just going to talk through some of the latest NICE guidelines, the COVID guidelines, some of the benefits of see and treat, and look at some of the cost savings associated with moving your procedure to an outpatient setting. So over to you, Sarah.
Thank you, Alan. So I'm just going to start by reviewing some of the recommendations that are included in the current NICE HMB guidelines. And this is in support of improving the outpatient efficiency within the service and really looking at suggestion of how you can progress to see and treat. So it's recommended that women are offered a hysteroscopy if their history suggests that they have submucosal fibroids, polyps, or endometrial pathology. And there is support to progress to a see and treat hysteroscopy service if feasible. And then also, if you are looking to obtain an endometrial sample, that is performed under visualization ideally, and not offering a blind endometrial biopsy. So just on that note, there's some clinical data here that suggests some of the limitations associated with the blind retrieval of biopsies and endometrial sampling using either curette or polyp forceps, and looking at the complete removal. So really looking at trying to ensure that you do have an effective treatment option, that the complete retrieval can be up to maybe only 4%, and then also looking at polyp forceps, maybe only 41% of that tissue could be successfully removed. And then there's risks associated with doing a blind procedure, such as perforation rates. The operative time could be longer, and increase of infection rates as well. So obviously under the current climate, there are also some recommendations that have come out now from a variety of societies around how to perform safe procedures under the kind of current COVID infection risks, looking at how this can benefit with regard to incorporating a see and treat pathway. So looking at trying to avoid multiple insertions of a hysteroscope, so insertion and removal, which could align with doing resection type procedures or DNC curettes. Also looking to choose a device that will enable you to perform an effective and a fast procedure, so limiting the risks and time of the procedure. Hysteroscopy is not considered an aerosol generating procedure, so there are limited risks, but still there are some risks that could be associated with the procedures. It doesn't suggest that there is presence of COVID-19 currently in genital fluids, but that's not been completely ruled out. And then also looking at really offering the safest option, so really looking at offering patients procedures that can be performed in an outpatient setting, which will minimise the amount of time they're in hospital and minimising risk of exposure to COVID-19. So what are the benefits of a see and treat service? So we've used here the get it right first time, GIRFT terminology. So really looking at that fast and effective treatment pathway. So we've looked at the potential benefits from a patient's perspective. So minimizing that infection risk, looking at obviously not having to spend as much time in hospital, less time off work and travel, and obviously the expense of that, less anxiety associated with being able to get a faster result, and the comfort of obviously having a shorter procedure and being able to tolerate that, potentially with using MyoSure or associated devices. And then for the hospital, you would look at obviously reducing that infection risk, as we mentioned with the kind of recommended guidelines. Look at how you can effectively utilise resources, theatre capacity. We know with restoration of services at the moment, there is a big backlog, so obviously enabling you to be more efficient with the use of theatre space. Cost savings, huge cost saving implications with how you can streamline your services and pathways. Reducing the risk of DNAs, that's obviously sometimes now, I think, more than ever prevalent with regards to concerns, but also looking at that ongoing waiting lists as well as backlog and how you can improve on that. And then increasing patient choice, and that's what it comes down to, that patients do have a choice, and hopefully that will ensure that they're satisfied. So here's a suggestion of the kind of current pathways, and this can differ from different trusts, but it gives you a suggestion of how this pathway could be streamlined. So suggestion of being that you would have a first attendance and potentially a scan within that first outpatient appointment, then the second appointment where you may just have a diagnostic hysteroscopy if required, and then you would bring that patient back potentially for up to a third appointment, where again you could perform an outpatient but an operative hysteroscopy procedure, and that could be streamlined into 2 appointments, but essentially a minimum of 2. So then you would look at how you could streamline that into 1. So you could actually do a one-stop where you could perform all of those diagnostic procedures and then progress to an operative hysteroscopy within that 1 session. And then looking at how that can sit within day surgery. So if you aren't utilising outpatient operative hysteroscopy, then it essentially could be that three-step pathway, again, with additional costs associated with that, but that needs to have that operative procedure within a day case setting. So again, you've got those 3 steps versus essentially converting that into one. So there are huge cost-saving benefits of doing this. Not only are we improving the patient care and the streamlining the pathway, but also there are costs associated with it. So this is an example of some of the tools that we can offer with regards to calculating some of these costs. We've taken some of the data from the hospital episode statistics. So this has got trusts within England that we can look at some potential procedure codes and the volumes that you could look at converting with regards to using either operating in day surgery or just looking at the potential volumes that you could streamline. And here's an example, so you can look at benchmarking. So there's some suggestions of how you could improve on that with regards to costs, and looking at waiting lists and information like that in here as well, that you could look at comparing with neighbouring trusts or just across the benchmark across the UK. We also have then the tariffs. So now if you're looking at payment by results, there are obviously tariffs associated with these procedures. It is the same tariff if you perform the procedure under local anaesthetic in outpatients, or if you do it under GA in day surgery, so you obtain the same amount. And then in the calculator, we've indicated which type of MyoSure device that you may be using, and then it will give you an idea of what those costs could be. So you can break down the costs it would cost you for the use of the outpatient room versus the cost of theatre time, and then the consumables that you would be utilising within that. And you can see that the cost savings do add up, and they are considerable. This is looking at potentially converting a percentage of procedures. So you could look at converting, I think this one was calculating about 192 procedures, and then the cost savings there over £100,000 potentially, or losing that if you're doing it as a day case procedure. So this is just looking at purely at cost. So a lot of hospitals now are looking at block contracts or guaranteed income contracts, where you obviously, with regards to cost improvement programs, it's all about cost savings. So this just strips out all of the tariff, but focuses purely on how you could improve that based on just moving everything into the outpatient setting. And we put some examples in here with regards to if you had a nurse and one HCA that was in the outpatient clinic, and then the time it would take. So we've estimated here as an example, like 35 minutes. And then the costs associated with them, if you utilised a MyoSure manual as an example, and the amount of time that would cost with the room, compared to the theatre time, we've estimated an hour. And that's really, I think now, very much so the case because of infection control with regards to COVID, so the turnaround in theatre is taking longer. And then you can see that the costs then start to stack up with regards to looking at this number. We've got 100 procedures here, and this would be the potential cost saving if you were to move that number of patients into the outpatient setting. But in addition to the cost savings, you also save theatre time, which is always at a premium with regards to theatre capacity. And then obviously you can reallocate that to other treatments or departments. So here's an example. If you had 100 patients, you could save 10 theatre sessions, and that would give you an additional cost saving of £50,000 based on theatre time. And also, in addition to that, is capacity. So you could treat an additional 3 patients within that session, a 4-hour session, compared to potentially only 4 if you were conducting those in a day surgery setting. And then finally, how can that improve on a one-stop? So we've looked at the costs that would be associated with combining. So if you were going to, as we showed the pathway, you were going to combine 2 appointments potentially into one. So you, instead of doing a diagnostic appointment and then an operative, you could combine the 2 together. So that would give you an idea here of the costs that would be associated, as we showed before, of doing it in an outpatient setting. So you could then potentially, that would cost you 99 or 100,000 pounds if you were going to do it separately, versus if you combined it, you could save yourself 33,000 pounds by just having those the costs for that one treatment, one session for that patient. And in addition to that, it's obviously looking again at capacity. So as an example, I've put some figures in here around the time it could take to do a diagnostic hysteroscopy, estimated 30 minutes. Within a 4-hour session, then potentially you could treat 8 patients. So if you had 1 diagnostic clinic per week and then 1 operative clinic per week, we've estimated, especially at the moment with turnaround again within sort of infection control, you would be maybe treating 5 patients within operative clinic. So that means that within a week you had the capability of treating 5 patients. But if you did it as a one-stop, you could combine those. You could utilize those 2 clinic sessions, and enabling you to actually treat up to 10 patients within those 2 clinics. So if you looked at even hopefully improving as you go on, many hospitals who have adopted this practice are actually able to see and treat within a 30-minute time slot. So you would have the capability of expanding that up to potentially 8 patients in a one-stop clinic that you could potentially treat.
Thank you very much, Sheila.
Thank you, Alan.
Very good, thanks for the overview. So I'm going to take over this next section. We're just going to look at the MyoSure procedure itself and just go back to some of the basics and provide some more information on how the system works. So just to point out that really the system uses a handpiece, and at the end of each handpiece we have got like a cutting window, and I'm just going to put my pointer on. So cutting window is at the tip of each handpiece, and what we have is this window here, and this little device in here reciprocates and rotates on the automatic system, so it goes up and down, back and forward, taking little slices of tissue. But the most important thing I would like you to remember about the MyoSure system for the actual functionality of it is that we do need to have some suction at the tip. It's really important that we're able to suck the tissue in and then use this device here to go up and down to take those little slivers of tissue and suck that tissue down into a tissue trap where they can then send that off to histology for review. So just remember, we do need to have that suction at the tip. There are a variety of different hand pieces which I'll go into shortly as well, just to show you how dynamic they are and the different types of pathology we can treat. But in your hand, they do feel quite familiar, apart from one unique device, which is a MyoSure manual. Now I'll just move on to the next slide. Just for those who are not sure, this is how the procedure works. So you have got your hysteroscope going in to the uterine cavity, and then your device end will come through with that cutting window. The cutting window will then be placed on the pathology. It will cut through little slithers, suck the tissue in, and drop it into that tissue trap. So that is really what we're trying to aim for with the MyoSure procedure. The MyoSure itself can deal with a whole range of different types of pathology, but we can deal with type 0, 1, and 2 types of pathology, polyps and fibroids. We can do pretty much all polyp sizes, and fibroids would say up to 5 centimeters, depending on the handpiece that you choose. We also have expanded applications as well, so you can use it for separating adhesions, if you want to remove some retained products of conception, if you want to divide the uterine septum, and also some focal lesions. You can get right in there and just take that tissue away. So just to look a little bit deeper into the MyoSure device portfolio, there are a few things you need to consider when you select the handpiece. Now, you want to consider how big is the pathology, so what size is it? What type of pathology is it? Is it a polyp? Is it a fibroid? Is it just soft tissue? And also, whereabouts in the uterine cavity is that tissue originating from? So if we bear all those three things in mind, you'll then make the right selection for the most appropriate handpiece to use. This little chart here will give you some guidance as well, and just to try and break it down in a little bit more detail. We have got the MyoSure manual device here, and that is primarily used for directed biopsy, and also it will deal with polyps less than 1 centimetre. You can go back in numerous times with it, and we'll show you how that actually works. But on average, you say 1 centimetre polyps are achievable with that, and they can be done very quickly. The second handpiece to look for is the MyoSure Light handpiece here. Now, the light handpiece is used by a control panel, a control system, and a foot pedal operated, so it has got some power behind it and is automated. But this is a bit more dynamic. So what this one will do is this can do direct biopsy, and also it will let you remove polyps up to 3 centimetres. So you're able to get more done in a shorter space of time with that handpiece. If you then look at the reach handpiece, the reach handpiece is slightly different, and it's made from a higher grade of steel. It's also, if you look at the cutting window here, it is slightly larger than what you'll see on the light and also on the manual device. So it's got a larger bite to it, higher grade steel, but also the tip of it here is closer. The cutting blade tip is closer to the end. So that means for this device itself, this will do all polyps, and it'll also remove small fibroids up to 3 centimetres. But also, if you have pathology growing in the upper third of the uterine cavity, the reach is the best handpiece to go for, because it will let you reach up into the upper third, into the cornea areas, etc., and get close to the root of the pathology, whereas we have a 3 millimetre gap on the other handpieces. So the reach, 1 millimetre gap close to the pathology at the upper third. Another handpiece is the XL device here. Again, this has got a larger opening here. It's got a larger lumen in size as well, and it's made from high grade steel. And this is predominantly used for more advanced cases where we've got larger fibroids up to 5 centimetres. So again, we can do everything from directed biopsy right up to larger fibroids. And these are all being done in an outpatient setting as well, so they can all be achieved there. Now, moving on to the next slide, we're going to look at the features and benefits of the MyoSure manual system itself. So this is one of the latest handpieces to come to the range, and it does look slightly different to the rest. You'll see here on the screen it has got a handle to squeeze, and I'm going to let Stacey demonstrate this in a second. But also, we have got a tissue trap incorporated into the handpiece as well. So it's a kind of all-encompassing, all-in-one handpiece, and it's great for those fast starts, just getting started with the service with minimal fuss. We also have an integrated vacuum, and if you remember a few slides earlier, I said that the MyoSure handpiece must have some form of suction at the tip, and we can provide that mechanically. And on the MyoSure handpiece itself, every time you squeeze the handle, it will actually create this suction. It's quite a powerful suction. It will suck in the tissue and create a cutting motion to take that slither of tissue, which will then be captured by the tissue trap on the end. Another nice aspect to it is we have this 360-degree rotation tip, where you can use your index finger to gently rotate the cutting window into the appropriate location to remove the targeted tissue without having to physically turn the handpiece itself. So you can be nice and steady, and that's quite a nice thing for the patient as well. But what I'll do is I'm going to hand over to Stacey. I'm just going to let Stacey let you have a look at the MyoSure manual device in a little bit more detail.
Thanks, Alan. So this is the handpiece itself. So I'm just going to reiterate what Alan said, really. So, and on the end here, you can see a clear tissue trap. It holds 4 grams of tissue. You can go in and take a targeted biopsy. You can release it and empty that out if you wanted to, and then go back in and get your polyp. Or you can just take your pathology out, put it back in, and then just do your remove your pathology, and then this usually fits in your little histology pot. You don't even need to decant it. I'm just going to put that back in properly. So the handle, like Alan said, it squeezes together. That creates a suction at the tip of the blade, as Alan was saying earlier on. That's going to suck the tissue to it. It's then going to go down the sheath and sit in your little tissue trap at the end. And any fluid that came along with it is going to go down into this tubing. So you really want to keep this tubing in an under buttocks drape or a bowl. And as Alan said again, you can rotate the blade 360 degrees with your forefinger. So you don't have to move the device around. It's much more comfortable for your patient. And for the actual device, for the actual procedure yourself, when you're using the manual, all you need, you can see, is a drip stand, some fluid, a giving set, and one of our scopes. And it will literally just slide down the scope. You have a little laser mark on there. So this laser mark will indicate that when you go past the shoulder of the scope, that is when the cutting window is going to come into the cavity. So you go in, you rotate the blade in the direction that you want it to be, and then you squeeze the handle. You can see the cutting window going up and down. And as I said, it sucks the tissue and into the little tissue trap for you.
Thanks, Stacey. And also just that little tube that runs at the bottom of it. That's quite an important point because that can sometimes get plugged into the wrong area. So what would you suggest?
So it just needs to go into an under buttocks drape or a or if you've got a bin or a bucket at the bottom.
So that's just really an overflow. So every time you squeeze, you're taking a little bit of fluid out the cavity, and that just dribbles down there every so often.
Yeah.
So don't plug it into any suction.
No suction needed. It creates its own suction in the hand.
Fantastic. Okay, thanks, Stacey. Okay, let's go back to my slide deck. So just to show you the MyoSure itself here in a little video, the manual. So as Stacey said, they would have a standard drip stand with maybe a litre bag of saline and a pressure cuff. That will obviously depend on just how wide you'll be able to open up the cavity depending on the pressure that's there. But in here, what you can see here is just the cutting window in view, the kind of white light initially. So what you want to do is rotate the window, and ideally the technique for this to be quick and effective is to make sure the full cutting window is actually on the targeted tissue itself. And when it's on the tissue, you then just squeeze the handle, it will suck that tissue in, and then take that little bite, and then that tissue will then be captured in the tissue trap. So you can see here the consultant is using their index finger and they're just rotating round. So you're seeing that window rotate. You've got a little black marker there as well for guidance. So if you see the long black rectangle, you know that the very opposite end of that is your cutting window as well. So you can get orientation when you're in the cavity quite easily as well. So you just gradually make your way around, keep taking targeted pathology and samples, etc. under vision. Get onto the tissue, squeeze the handles and take a little slither of tissue each time as you go along. Okay, so in principle that's what's happening with the MyoSure manual device. And I'll see if I can move it on. So the manual, as I said, is slightly different to all the rest of the handpieces. The rest of the range we're going to look at is the MyoSure automated handpieces. So the features and benefit of this is, because they're automated, we will use the control unit here on the screen, and it will be, the actual cutting window will be operated by the foot pedal. So all you need to do is tap on the foot pedal and it'll start to operate the window. We can also record the time of each procedure, which is quite handy to know. And it's very simple, just plug it in and off you go. So the key handpieces to be aware of if you are using the automated system is the light device. And as I said earlier, that will do pretty much polyps up to 3 centimeters and targeted biopsy. We then have the reach handpiece, which will do all polyps and small fibroids up to 3 centimeters. And then we have the XL device, which will tackle larger fibroids up to 5 centimeters. So just be aware, these are the automatic range, which will use that box. So here's another video just to let you see what the light handpiece would look like with that automated foot pedal operating the system. So here we have a polyp, and the consultant is already taken some of the polyp off right away, but you'll see we've got the suction, so it's sucking the tissue into the window, tapping on the foot pedal, which operates the reciprocation and rotation of the cutting window, and literally that is it. And I think this video is maybe 20 seconds long. So really, sometimes you blink and the pathology has been removed. It's so quick and efficient. The other thing just to let you see is if we want to take some global biopsies, so under vision, initially maybe a little bit of pathology there, so there's a little polyp, they're just going to quickly remove that. And then they're going to start to go around the cavity, taking that kind of global view and taking samples from all around the cavity, which will help improve your patient diagnosis. So rather than having a papel and you're just maybe going from one spot, and we have to kind of hope that we're able to get some good quality tissue samples. Here, under vision, you're able to just quickly go around, just taking little slithers of tissue around the endometrium. That's all been sucked back to a tissue trap, ready to go to the histology department for review. Again, it's very quick and simple to use as well, and nice and safe because it's under vision. Okay, so we've looked at the devices. We know which handpieces that are available, and you have to pick which one is the most appropriate for what you see, type of pathology, the size of pathology, and whereabouts the pathology is in the cavity. But what you will also need is a hysteroscope. For many customers over the years who may have the original scope, which is the MyoSure hysteroscope, that works very well, and that's got a 6.25 outer diameter. But what we now have launched in the past 6 or 7 months or so has been the Omni 3-in-1 hysteroscope. I just want to let you see this because it's been specifically designed to help to move towards the see and treat service. So the key things to know about this one are the following things. There are 3 sheaths in the setup of the tray, which I'll show you in a second. I'll just put my pointer back on. But we have got a diagnostic sheath. So for diagnostic procedures, you would we have a maximum diameter of 3.7. So this will let you go in with a bag of saline, standard hysteroscopy setup, put your diagnostic sheath on, go and have a look. And if you do identify pathology, then it's a simple procedure of just remove that sheath, which just slides off. We then will attach one of the 2 operative sheaths which are in the tray. So the first operative sheath is 5.5. And as I said earlier on, if you're using the classic MyoSure scopes, that original diameter is 6.25. So we've been able to reduce that diameter to 5.5, which is again great for an outpatient setting. And this will let you use pretty much the majority of the handpieces except for the XL. But we're also future-proofing the department. So in that tray, if you do eventually move towards larger pathology, treating larger fibroids, we also have an XL sheath in that tray. So that means eventually, if you want to start treating those fibroids, we can just slip on the XL sheath, and that has now got a diameter of 6 millimeters. And previously, the XL hysteroscope that was used in the past, the MyoSure hysteroscope, is a 7.25. So again, we've managed to reduce that from 7.25 down to 6 millimeters. A couple of other key things to note. For the operative sheaths, we have now got oval shapes, which are making it easier to go through cervical canal into the uterine cavity. We're still maintaining a glass rod within it, so we've got the optimum visual feedback as well, because it's glass and not those fiber optics that we see. So it's a glass rod. And also we've made it longer, which is a big thing. We've now added an extra 2 centimeters onto it, so now we have 200 millimeters working channel. So for the larger patients, we're able to get deeper into the cavity, making life a little bit easier. This is what the tray would look like. So when the scrub nurse would open it up, what they would see is your main body scope here. And then we have the 3 sheaths we mentioned. So we have the 3.7 sheath here. That will just slide onto the main body of the scope for your diagnostic. I've got the 5.5 sheath here. So when you have identified pathology, we just take off the black coded sheath here and put on the blue coded sheath. But then if you do want to progress those larger cases, again, you've got your green 6mm for your XL handpieces as well. Within the kit, you've also got a few little end caps which go onto the end of your outflow channels here for your operative procedure, and also you've got an end cap to go on the end here. So pretty much that is what the tray looks like. Everything's got a house, everything's got a code, nice and simple to use for the staff. So now, because we're looking at the Omni, we're going to look at different configurations of the Omni, just to explain it in a little bit more detail. So for the diagnostic procedure, pretty straightforward, as we said. You go in, put your sheath on, it's your black sheath, slides on, quite easy. And then you see some pathology, you'll then remove the black sheath, put your blue sheath on and your outflow channel. But what I'm going to do is I'm going to pass over to Stacey, who's just going to let you show you how simple it is to make those transfers of the sheath. So back to you, Stacey.
Thanks, Alan. So I'm just going to set it up. So I've already put the end cap on the main body. I'm just going to put the camera on the scope, and in the tray you have adapters for your light lead. So depending on what stack system you use, you just need to put one of those on like so, and then my light lead. So as Alan said, they do have the numbers on the side. So I don't know if you can see that, but it says 3.7. So if we were doing a diagnostic, you place the sheath over the little rod here, and then you can line up the two arrows in the same direction, and they just clip into place. And then you would add your outflow channel, and then you would go inside the patient, you would have a look, see what type of pathology is there, and then if you needed to, if there was pathology, you could choose either the 5.5, the blue one, or if there was something larger and you had the XL cutting blade, then you'd be able to choose the XL sheath. But it's a simple, take your fluid off, and then you literally press the button, slide that one off, and again line up both your arrows together. Just simply click into place and add the fluid back on. There's no changing of the camera cover, there's no changing of the camera, the light lead or the camera. It's really, really simple. And then you go in, you would put your blade down the end, the cutting device down the end, and then you're ready to go.
Perfect as well. And just we'd also be able to put the outflow channel there as well if you did want to go in and have a little look again and clear the view a little bit if need be. That is available in the kit. Perfect, just like that. Thanks, Stacey. Okay, so we will then, just to be a bit clearer, just to show you, if you do go for the XL again, it's all color coded as Stacey said. But I should also mention we have done a kind of more detailed review of the Omni hysteroscope in a previous session, and we've recorded that session. So if it's something of interest to you, you want to know a little bit more about the Omniscope and the exact setup of it and the handling of it, just contact us on the email address I provided or your local representative, and we can send you a link to that overview and you can familiarise yourself in a little bit more detail with it if need be. So what I want to then look at is the various options that could be available for taking the kit into your outpatient department for this fast start to a see and treat service. The three options are, and this is the most basic and probably simplest way to go for it if you really just want to get started and get your patients into the outpatient setting and offer this service, is go for number one, which is the fast start option using the manual device. If you want to potentially deal with more larger pathology, more fibrous pathology, etc., you could then look at potentially using the simple setup, and that uses different types of handpieces. And again, we'll look at that in a little bit more detail in the following slides. And finally, we could also look at using the fluid management system, and that would allow you to do pretty much all pathology. And as we start to deal with larger pathology like larger fibroids, etc., a fluid management system is probably in most cases going to be recommended, because it'll let you control that intrauterine pressure and just give you feedback for those longer types of procedures. But we'll have a look at that now in a little bit more detail. So number one, the fast start using the MyoSure manual, and you could use your Omniscope or your current classic MyoSure hysteroscope. So within that setup, you'd have a drip stand, you'd have a bag of saline and a pressure cuff, and usually maybe 1,000 mils would be fine for that, for those types of cases to do your diagnostic look. You've got your MyoSure manual device, so this could be targeted biopsy and small polyps up to 1 centimetre. And then you take your pick of your scope. So right away, your patient comes in, you see something there, and then quickly, within a few minutes, you'd have the MyoSure manual in your hand, and you're able to remove that pathology and get a good quality sample. And it's minimal fuss, easy to set up, very, very quick. The second option to consider would be the expanded see and treat service. So this would be using the automatic MyoSure and all the handpieces, so that's using that box, with again the Omni or your classic MyoSure hysteroscope. So the setup for this, again, pretty straightforward. This is a drip stand, your bag of saline and a pressure cuff. But this time we will need a tissue trap and we need portable wall suction or your portable or wall suction. We do need some form of suction. Again, going back to that point, we just need to create some suction at that tip to make the procedure go smoothly and successfully. So along with that setup, we would have the MyoSure controller, your pick of hand pieces, and your Omni or MyoSure hysteroscope available. Now, previously we looked at the MyoSure manual, which has its integrated tissue trap, but here in this one, when you're using any of the automatic devices, you must have this tissue trap. So as we suck those bits of tissue that are being chopped off from the cutting window, they're traveling down and we're going to capture them here in that trap. And we need to have that suction to create that suction at the tip. So again, just make sure we have some form of suction in the room available. We have this quick setup guide as well. We can give these out and it's just a very quick reference as such, and it just takes you down a route of what you want to choose for each procedure. But it's basically what I described in the previous two slides. Going to step 2 would be using your manual. So you don't really need anything other than your bag of saline and your drip stand and your hysteroscope. But if you are going to try and tackle slightly larger pathology, then you will need some form of suction and your tissue traps, etc. Oops. So then the final one and the final option is using the fluid management system. We have the Aqualex system currently available, and this is something you probably are quite familiar with in many hospitals, particularly if you have this in theatres. A lot of our customers will have the Aqualex fluid management system to assist. And then again, you'd use that with the whole range of handpieces and your choice of hysteroscope. So this is what the setup would look like. You'd have your full set of kit here. You'd have your MyoSure controller with the fluid management system, your range of hand pieces, and again, just to reiterate, if you are going to go down the route of using the automatic system, that would be your light, your reach, or your XL, and your hysteroscope. Okay. Now, in this setup, probably a little bit more training and support is required initially just with the Aqualex system. And the team are on hand, obviously, to help our customers with the training on that. But it can be more of a learning curve to get to that point. So if you are trying to set up that fast see and treat service, starting off with that basic manual or just going for the basic setup of having the control system and the standard hysteroscopy setup would be a good way just to get started with it and eventually migrate into using a fluid management system. So the Aqualex system itself, if you're not familiar with it, is a system where it will allow us to pump saline into the uterine cavity, and the consultant will control the pressure at will, and it can range from 40 millimeters of mercury pressure up to 150. So if you want distension quickly on demand, you would just tell your circulator to turn the pressure up, and the Aqualex system will do that. The other great aspect of the Aqualex system is it will give you real-time fluid deficit. So particularly as you start to migrate to being able to achieve removal of larger fibroids, which the cases can take longer, you probably will have certainly more concerns around the fluid deficit limit. So this system will suck back the fluid coming from the under buttock drape and also the outflow channel in the hysteroscope, suck all that fluid back into the canisters you can see on the screen. And the canisters are actually being weighed all the time. So the weight of the fluid then gets taken off from the count of fluid going in. And on the screen, will give you that live fluid deficit. So it's great for patient safety, great for controlling the environment you're working in. But again, just take a little bit longer for the setup and the training of the nurses. And it's something, as I say, we can assist with that. And just to remind you, the BSGE and ESG guidelines from 2016 do suggest that certainly for those prolonged cases, having some automated pressure delivery system would be advantageous. And for a healthy patient, 2,500 mils is the maximum absorption of saline for that patient. But again, you may want to change that if the patient is compromised anyway with the Aqualex system. You can actually determine what is the maximum amount of fluid you'd want that patient to absorb, and the machine will start to alarm as you get closer to that preset fluid deficit limit for that particular patient. So, excitingly, for many years now, our customers have enjoyed the Aqualex system, and it really can improve the procedure performance overall and give you that control. But I'm delighted to say as well that very soon you'll find that the Fluent system is going to come onto the marketplace within the UK. It's already used within the United States and also Canada. And this is a revolution in how we're going to progress into offering you something which is really dedicated for the MyoSure procedure itself, and creating a nice simple setup and much better control. So coming soon, we have got the simplicity of easy click-on flow cart packages, cartridges, which click into the system. The staff who support the fluid management system will find this system so easy to use. There's a touch screen. It will walk you through every step to make sure it's all set up appropriately and easily. And it's got a double peristaltic system as well, so it gives you much more control of holding that pressure in the uterine cavity, which ultimately means we use less fluid throughout the procedure. So again, we're not having to change bags as much. But this is coming onto the UK market very soon. So if you're interested in this, watch out for it. And I'm sure your local sales representatives will be in touch to give you more information when it's here. So again, just to reiterate, there are 3 options available if you want to move to that fast start see and treat service. The basic one is the manual system. The second one is a simple setup, but we do need to have some form of suction, wall suction, portable suction, or you could go straight into the fluid management system with all devices, and you could tackle larger pathology as well. So those are your 3 main options. Managing your patient now, this is a section to consider. You're all generally be familiar with using the hysteroscopy setup, and technically using this MyoSure setup here, it shouldn't be anything too different to what you're already used to. We know that our current clinicians using the MyoSure setup will use a local anaesthetic, so a paracervical block, etc. But also many are using the vaginoscopic technique as well, and just using the pressure of the fluid to open up the cervix to allow us to then enter into the uterine cavity. So we also have a wealth of information on what type of local anaesthetic consultants are using across the UK. You'll see here on the right, this is a patient advice leaflet as well. So these can be given out in the consultation phase with the patient, but also certainly want to leave that with the patient if they've gone for a see and treat, they've come in, they've identified something. This will tell them what the procedure has been all about and give them some information for when they leave and go home. It's obviously important to tell the patient what to expect, but generally the procedure is very, very well tolerated. And vocal local can go a long way. Having your nursing staff at the side, just keeping the patient's mind off the procedure can help a lot. But generally the procedure is very quick, literally sometimes in the blink of an eye, it can be all over and the pathology has been removed because the MyoSure is so efficient. So Hologic can help you, and there can sometimes be a lot of documentation involved in the setup of a new service. And rather than reinventing the wheel, we have lots of things available from different trusts that you could look at, and you could use their documentation. So some of the examples of that could be looking at the medication, the pre-med protocols. So from Shrewsbury and Telford, you can see something here. Look at some from Bolton, and as I say, many, many hospitals. We can give you a range of what they would generally use, and you can decide yourself what is going to best suit your practice. We have patient consent forms pre-made. Again, you could take these and you're able to put your own trust's details at the top if need be. You can review them and use what you feel is appropriate. We also have the outpatient hysteroscopy MyoSure op notes. Like before, you know, we have a whole range of different ones. We've got Telford there, we've got Bolton and the Royal Cornwall hospitals as well. And we've got patient information leaflets which have been generated as well individually for different trusts. Again, you can have a look at that and use that if that's something you would see as a benefit. So don't reinvent the wheel, come to us, we can come and help you get started with all that very quickly. And another thing you probably will have to be involved with a business case kind of set up just to explain what you're trying to achieve and what the benefit's going to be and the costs, benefits, etc. And we have something available. We have a generic one for a see and treat service available to you. So like Sarah had mentioned at the start of the presentation, we can look at the individual costs associated to your trust or your hospital. We can look at those numbers, we can input them into this generic business case. You're able to edit it to suit exactly what you need. There's a lot of information through all the pages of the documentation that we have. So you can cut things out. We can tweak some of the numbers here and there to make it exactly appropriate to your service. And then hopefully the executive summary will be hard hitting. It will give you all the information that you need to get a positive result at the end of it. So come and talk to us, come and talk to our sales team. We'll be delighted to start some conversations around that with you if that's where you want to progress. And finally, before we go into the Q&A session, Hologic is always here to support your needs. So like Stacey and the rest of the team, we do offer different forms of training. And if it's appropriate, we are more than happy to come in and provide hands-on training with simulators. And also we've recently invested in some equipment where we've got much more realistic uterine models with polyps and fibroids inside, and the screens and things. We can bring everything into your office setting, as you can see here on the pictures, that we can set it up literally anywhere and go through that training technique to give people the confidence to use the equipment in different types of modalities being set up, like the 3 options we discussed prior to this. So having said that, I hope the information has been quite clear and useful, and as I say, we are here to help. But I'd be interested now to know from the team, have we received any questions from the...
Yeah, we have. Yeah, we've got a few questions here.
Thank you. I'll just stop sharing so we can see each other.
Let me start with one here about, can you collect more than one biopsy or sample of 1 centimetre polyps using the MyoSure manual device?
Stacey, do you want to answer that?
You can use it, so we say 1 centimetre, but it can be multiple 1 centimetre polyps. It holds, as I said, 4 grams of tissue, so it can take multiple. And if you wanted to collect your polyps, and then you could empty, you could take that off, as I showed you earlier. You could take that off, decant the tissue into one of your histology pots, put it back on, and then do a sample, and then put that sample into another histology pot. So you'd have 2 separate histology pots to send off to histology. So yeah, you can.
Great, thank you.
And would you mind, Stacey, just reiterating what you were saying about the tube and where the tube is connected for the MyoSure manual?
Let me just put this back on. Yeah. So with the manual, as we said, it sucks obviously the tissue through the end, and it also sucks the fluid through. So the tissue is going to come into the tissue trap, and any excess fluid is going to come down this tube. We don't need it connected to suction. It just needs to be put in an under buttock drape, or in a bin, or in a bucket, whatever you have at the bottom there. And then you're using such minimal fluid with the MyoSure manual that there's no, I mean, you can calculate it manually. There's no need really to have a fluid management or suction to collect the fluid, add up the fluid. So it just goes into a bucket and we can calculate it.
Great.
Sorry, I made that sound very...
To clarify, Stacey, what degree is the Omniscope and the MyoSure scopes?
So they're 0 degree scopes, because you need to be able to see what you're cutting.
Great, and that's for the sheaths and everything. So all the operative, diagnostic, they're all the same, 0 degree. Perfect. Another question's come in about how different is this from the Bugatti shaver?
So it's a good question. I'm not aware of really anybody using the Bugatti, so it's difficult to know.
Well, I can
you
certainly
maybe know some
step
more.
in and answer. Yeah, I mean, just as far as the difference being that we have disposable devices and the Bugatti shaver is reusable. So that's the kind of predominantly ours, you know, you don't have that. You need to obviously with the scopes, you would be able to reuse the scopes, but the actual devices are single use. And then the diameters are different with regards to the dilatation. But that's predominantly, I think, the two main differences.
Well, every single. Sorry, could you hear me there?
No, sorry.
Sorry. The beauty of WebEx. So it's a good point you raised there. I think a lot of our customers get concerned about potential overuse of the sterilisation of different blades that we'd use in the Bugatti or any type of product that gets re-sterilised a lot. Whereas with ours, because it's single use, sterile every single time, it's just peace of mind, you know, it's going to be sharp, because I'm not sure, how can you tell if it gets used time and time again, the blade from the Bugatti, is it still sharp after patient 20 or patient 30? I'm not sure. So I think with ours, you know, you're going to get something that's absolutely sterile and sharp every single time.
Great, thank you. Can you please show the connection of the MyoSure manual to the hysteroscope? So how that's inserted again. Stacey, could you just show us that again?
Yeah. So this is obviously the manual. This is the scope, and just down the end of the scope, it literally just slides. There is a little bung in here to stop any splashback of the fluid coming along. Can you see? And then it just slides down. And again, there's a little black laser mark here, and that indicates that once I go past the shoulder of the scope, the cutting window is going to come out at the end there. So I pull it back and it's not in view. I push it past the black laser mark, and that's when it comes into your view. I hope you can see that.
Yep.
And then again, to rotate the blade, you would use your forefinger, and that will turn it 360 degrees.
Perfect, great.
Okay. Thanks, Stacey.
Another question here about what, why is there a limitation potentially? You mentioned about the MyoSure XL having upper limit of 5 centimetre fibroids. If you want to just clarify that.
So there comes a point where, for certainly larger, more fibrous pathology, it can take a longer time to get to the point where you're getting down to the root, and eventually the blade can start to become a little bit blunter. So we just have to have some kind of guidance to say this is roughly what we're looking for. Potentially it could do larger ones. It's going to depend on just how fibrous the tissue is. It's difficult to give you that exact figure, but certainly if you can, if you've got a slightly softer fibroid down to the base, then there's no reason why you couldn't actually achieve more, because it's the tissue trap at the end of the day that's going to collect the tissue, and that's going to be held separately, normally using an Aqualex fluid management system. And you can just keep on emptying that pot with the tissue and refilling it each time if need be. But the pots are generally quite big.
Yeah, and I think the limitation is going to be your fluid deficit.
Yes.
So, you know, you can treat larger pathology if it's, you know, softer, and like you say, it's quicker as far as the procedure. When MyoSure was first created, it was intended to be a sort of 10-15 minute procedure, and that with the intention of it being outpatient focused, as Alan alluded to. So I think that was always the intention, but obviously as an inpatient procedure, it could go on for longer. So I think the limit is going to be once that fluid deficit reaches that 2.5 litres. So if it's, you know, more than that or not, or potentially having to do it in 2 sittings, which I know quite often can happen with larger pathology, with doing resections and things as well. So that's the kind of guide, but it's not to say that's the upper limit really. Okay, what about, does the automated devices generate any heat in the cavity?
Very good question. Probably should have said that during the explanation. So no, there's no heat generated. It's all cold steel. So there's no thermal damage to the cavity or tissues around that, which is one of the reasons why we do have fantastic quality samples coming back. There's no charring. And another thing as well, we do have a side cutting window, so we can tend to follow the contours of the cavity as well. So you can't cut too much, because it just eventually becomes back to the normal shaped uterine cavity because of that side cutting window safety aspect.
Great. And what about, can you use the 6mm sheath on the Omniscope for the reach and light devices as well?
Yes, is the answer. If I can compute what you're asking there. Yes.
All right.
So yeah, basically something all handpieces on the 6.
Yes, yes, absolutely. And the same for the MyoSure XL scope. You can use all devices down that, but obviously to reduce dilatation, it's only now the difference of 0.5mm. But obviously you can reduce that dilatation if you don't need to. You can use the 5.5 sheath, so absolutely. Okay, another question here. If you're predominantly right-handed, what would be the best way to hold the scope and the MyoSure device when operating with the light or reach devices? Can you demonstrate that? So if you're right-handed.
Yeah, sorry. So it all depends on how comfortable it is for you in your right hand. But if you're using the Aqualect system, we tend to say it would be better situated behind you if possible, and then all your wires could just loop nicely behind. But yeah, and it's best to hold the actual scope and not the camera, because you can tend to turn the camera and lose your orientation. So hold the scope. And then, yeah, I don't know, it just depends. I mean, for me, I would be holding it with my left hand and using my right hand with the cutting window. And I think most surgeons that are right-handed do that, but it would literally be whatever is comfortable for you.
Yeah, 'cause I think you're going to be, the dynamic part of it is going to be using, if you're right-handed, holding the actual handpiece, the device in your hand, to allow you that manipulation. So that'll give you much more finesse. And the left hand can just support your scope, so just hold the body of the scope like Stacey's got there, and not the camera, and that will keep everything in place and pretty straightforward.
Perfect. Another question here about using MyoSure to resect uterine septums. Do you have a video of this procedure that you could share?
Sarah, maybe you could answer that.
We don't have, certainly, I'm sure we have now a lot more consultants using, in the hospitals in the UK, we have got experience now with retained product of conception, more utilisation of MyoSure for adhesions as well. So I haven't personally got a video of it, but I know we could probably get hold of one, because people are now expanding use with it. But we certainly heard most people will use a MyoSure Reach device for that, because of the access with the position of the blade being slightly closer to the tip, depending on where the septum is, but typically it'll be sort of fundal. So that makes it easier. And the same for retained product, in case it's got a little, the tissue can be slightly tougher potentially. So that may, again, to get right down to the base, it makes it easier. But we can certainly follow up and see if we can provide some guidance, more guidance on that anyway. Great. Okay, just one more question. Can it be trialed? So can they actually trial this if people are interested?
So the answer to that would be yes, absolutely. The best way would be to contact us on the email address, which I'll show you just at the very end. It's the same address I showed at the start. Or if you do know your local representative, just contact them, and we'd be more than happy to come in and run through the best options for your service. But we do have Omni hysteroscopes available on loan for evaluation, just short-term, usually 2-week evaluation periods. So you can set up some cases and we can come in and do some if you want to get some of the hand pieces. But yes, so the answer to that is yes, we are here, able to help, and are more than willing to come in and let you test it for yourself. Perfect.
So I have one more quick question. Just asking about the difference between our fluid management system and the TrueClear fluid management system, if there's any kind of differences there. So I can answer this question. They are very similar in the concept, but for us, we're obviously going to be, as Alan mentioned, very soon launching our new fluid management system called Fluent, and that will be quite significantly different. It's going to be much more intuitive, provide more capability with regards to less accessories, so really enabling you to streamline your procedures to save time and improve training, and I think generally efficiencies within your procedures. So that will be coming soon, and that will be quite significantly different.
Thank you. That was great, Sarah. No more questions?
So no more questions, no.
Excellent, thank you. Thanks very much, everybody. So just going to show my last 2 slides, just to finish this off. And it's just to say that we have been conducting various types of live WebEx training events over the past month or so to try and prevent the footfall of your local reps coming into the hospital. But if it is of interest, you'll see here I've put complete on the right-hand side. These are all ones which we've done in the past, and we have recorded them. So if it's something of interest to you, like looking at the MyoSure, if you're looking at that for any reason, and you want to look at moving that into an outpatient setting, looking at troubleshooting, seating techniques, etc. There's a video available for that. We also have one with a more detailed Hysteroscope, which I previously mentioned. And we've done with looking at setting up the Aqualex MyoSure, troubleshooting, etc., really getting to know it in a bit more detail. So all these videos are available, so just have to ask us for it, and we'll happily send you the link to let you see that. We also have tomorrow evening, if it's of interest to anyone watching, we've got some fetal fibronectin webinars, and we're going to do a review of quantitative fetal fibronectin tomorrow evening at 6 o'clock. And the following week, we've got a guest speaker, Naomi Carlisle, who is a senior research midwife in preterm birth at King's College, and she is going to be discussing the Quip app in more detail, because they have actually created this new app there, which is going to make a big difference to the preterm birth outcomes for many patients. So feel free to join us on that if you like. Also, we've got a webinar coming up in the next few weeks' time, and it's going to be looking at the MyoSure system, but it's actually the quality of the pathology. So getting it right first time with MyoSure, a pathology perspective, and that should be taking place on Wednesday, the 22nd of July. So finally, it takes me great pleasure to say thank you very much for joining us this evening. I hope you have found it useful. And if you have any other questions, etc., that we've not had to answer, please contact us on ukginsurgical@hologic.com. And also, just to reiterate, if you would like a training certificate for attending this event and you have shared a device, you're on one phone or an iPad with a few people watching on the one device, please contact us on ukginsurgical@hologic.com with your colleagues' names and the hospital you've attended from, and we'll happily create them their own certificate for this event as well. And finally, if you are looking for more information on the products like NovaSure, MyoSure, and Aqualex, it's worth a look at the ginsurgicalsolutions.com website. So just type that in, and that will take you to an area where there's lots of information, videos, instructions for use, etc., on all these products. So thanks again for joining us, and I hope you have a great evening. Bye-bye.